Oral health is an important aspect that we promote at Tooth Heaven. Some may assume that when you go to the dentist, we only focus on teeth, but that is not the case at all. The oral systemic health. What does this mean in simple terms? Essentially, it is the connection of our oral health and our overall health. When you think about it, the mouth is a direct link to our body. We are able to breathe, eat, drink, and swallow. Anything that travels in gets spread throughout our circulatory system and ultimately has an effect on all of our vital organs. In this video, our goal is to educate you that your mouth plays a vital role and is also reflective of your overall health. In fact, diabetes has been proven to have a direct relationship to periodontal disease, which is the extensive form of gum disease. If your diabetes is not well controlled, this consequently affects the health of your mouth, and vice versa. Having unstable periodontal disease worsens the severity of diabetes, as the presence of harmful oral bacteria triggers the inflammatory response, resulting in higher blood glucose levels. Having such high levels of inflammation in the body will ultimately affect your health, thus increasing your risk of other systemic diseases and events of a stroke or heart attack. Here is a diagram which is also listed in our clinic showing the effects of oral inflammation. As you can see, starting from the brain, it has been linked to Alzheimer's and dementia. Many studies have shown that older people with periodontal disease may have an increased risk of Alzheimer's. A harmful bacteria associated with periodontal disease would be P. gingivalis, which is a high-risk pathogen that can play a part in causing inflammation not only around your body but also towards your brain structure. There is strong evidence that reducing the oral inflammation can help reduce the possibility of many systemic diseases, including Alzheimer's. People who smoke are not only at increased risk of gum disease, but they also have a higher risk of heart disease and stroke. An essential part of our role is to also undertake an oral cancer screening of your mouth. This is where we can spot any early signs or lesions that are already cancerous, and thus, if spotted early, can help improve the prognosis. In terms of the heart, we have established that bacteria from the mouth travels into the bloodstream, causing systemic inflammation. There is a connection, although not fully understood, that heart disease, clogged arteries, and stroke might be linked to the inflammation and infections of oral bacteria. Oral inflammation can raise the risk of heart attack by 13.6 times, twice the risk of a heavy smoker. Certain bacteria from your mouth can also be pulled into your lungs, causing pneumonia and other respiratory diseases. It's just like breathing in oxygen. The aspiration of bacteria from your mouth travels all the way down into your lower respiratory tract. Many studies have shown of institutionalized and ventilated patients who have improved their oral health and thus had a positive outcome on their systemic health. With our kidneys, oral inflammation can stress the kidneys' function to fight off diseases. Both tooth decay and gum disease can trigger infections that can cause complications, particularly for people suffering from kidney disease. And lastly, with our pancreas, oral inflammation may disrupt blood sugars, resulting in diabetes. There is some association of oral bacteria that can be related to pancreatic cancer. And P. gingivalis, which we talked about previously, was shown to have an involvement in pancreatic cancer. Have you noticed that you bleed when you brush or floss? This is a sign of inflammation in the mouth, along with puffy gums, such as this. This is why majority, if not all dental clinics recommend 6 monthly cleans to prevent infection and inflammation and also improving your oral health quality of life. So don't disregard your oral health, it is just as important.
Hey there! If what we just spoke about speaks to you or someone you might know of and you'd like to find out more, we're more than happy to have a chat with you just by clicking on the links below. You can also contact us directly on our phone number on the number listed on this side. And if you don't already know about this, we do accept online appointments as well. And you can book yourself online from our own website. This video is just part of what we believe in Tooth Heaven, which is changing lives one tooth at a time. Until the next time we see you, thank you for watching and take care. Bye now.